Hello there and welcome once again to The Verdict. Mick, Cornett with Meyers. We're here every week meeting interesting people and dealing with topical issues, and today's something that I think is going to be very helpful for people.
Yeah, it really is a good show, and we're so pleased to be able to put it together with the help of the mental health group and substance abuse recovery folks at the state. We're bringing to you today Carrie Slatton-Hodges, who is the boss person, the commissioner of mental health and substance abuse services in Oklahoma, to talk about a new development. It's a suicide prevention hotline, a 3-digit hotline, similar to 911 or other 3-digit notification systems. And we have not had this before in Oklahoma or anywhere else as far as I know, and we're on the cusp of getting it pretty soon.
Okay, we'll learn more about it, and you're watching The Verdict. We'll be right back.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other. And we're not going anywhere.
Military service ran in my blood, starting from my father, which joined the Navy. On the Chickasaw side, my uncle, which served in the United States Army. I'm Benjamin Espinosa, Chief Petty Officer, United States Navy, and I'm Chickasaw. I went to the Secretary of Defense's staff at the Pentagon in Washington, D.C., which ultimately led to becoming a combat support technician for Naval Special Warfare, specifically SEAL Team 10. I think to be proud and to love your tribe, to love being Chickasaw, you also have to love being American. You also have to love everything that America stands for: equality, perseverance, professionalism, and power. I want my family to know that their father is a good person, but also feels that he has an obligation to the country and to love this nation. Anything worth having is worth dying for. The military and the country owes me nothing. I owe it everything.
See more stories about the Chickasaw people at profilesofanation.com.
Welcome back to the set of The Verdict. Mick Cornett with Kent Meyers, and Kent's going to introduce today's guest.
As we indicated, we are really pleased to have Carrie Slatton-Hodges, the Commissioner of Mental Health in Oklahoma and Mental Health and Substance Abuse Services, join us. She's going to tell us about what's going on in her department in a very, very critical part of Oklahoma's functioning as a livable state. Carrie, it's sure good to have you. Let me talk a little bit about your background. You became the chairman in April of 2021, I understand it. And prior to that time, you had worked as a deputy to the then existing commissioner for a number of years, 12, 13 years. You did your undergraduate work at Southern Nazarene University and your master's degree work at Southwestern Oklahoma State University in psychology. And you have been for 30 years a licensed professional counselor in Oklahoma, although not practicing at the moment. When you come to the department, certainly well-equipped and well-experienced, and we're sure glad you'd give us the time to talk about this exciting new development.
It's my pleasure, absolutely.
Why don't we start with that? What is this effort, and what do our viewers need to know?
Well, 20 out of every 100,000 Oklahomans dies by suicide, and that is by far too many. Just a little bit of information around suicide in Oklahoma. 80% of those people are male. Now, females attempt just as often or more often than males, but males, particularly in Oklahoma, when they attempt, they use a very lethal means, which is normally a gun. And actually that is true in Oklahoma, both for adults and children dying by suicide. And so this, and because it is oftentimes a more impulsive act, the way that you die by suicide or the way that you attempt makes a big difference in the outcome. So we've had various hotlines, we have places to go for years, but we have a big game changer coming up that we're so excited about. A couple of years ago, federal legislation was passed that brought into place that there would be a new number that can be dialed from any mobile phone or any landline that is 988. And similar to how people dial 911, when there is criminal activity or something of that nature, this number will be the same way. But because by default, by not knowing where to call, many people dial 911 when there is a mental health emergency or crisis. And law enforcement are oftentimes the first responder in those cases. Well, over time, people have realized that really mental health professionals need to be the folks answering those calls in order to prevent any delays and making sure that a mental health professional gets involved. So when you call 988, starting July 1st, anywhere in our nation, but in particular in Oklahoma, because it is a state-by-state implementation, we will have a full evidence-based, comprehensive crisis system. And that has many components to it, one of them being the call center. So we will have a call center that will start on July 1st that can do so many things that we don't currently have the capacity to do. Number one, there will be licensed mental health professionals available so that if someone is in crisis, they can start to assess what is going on. They can make determinations about what needs to happen next. What that may be is that the mental health professional helps to de-escalate that crisis and bring a resolution to that. It may be that the person just wants or needs information. We can do that as well. Or say what they're wanting is it's 2 in the morning and they're feeling anxious and they just want someone to talk to. We have a warm line connected in this where they can do that. But if the situation through assessment is such that the de-escalation over the telephone is not the component that is needed, we will be able to dispatch statewide mobile crisis teams. There will be an assessment that's done to make sure that that is a safe route to go, and mobile crisis teams will then respond anywhere around the state to further visit with that person, de-escalate, bring family and friends as a supportive network there to help work through what is going on, what feelings are there, what risk factors are there, in hopes to be able to resolve the crisis at that point in time. Now, there's a couple of other things that can happen from this call line that is very exciting. Instead of then maybe getting a message that says, hey, tomorrow go to this place or call this place and ask them about getting an appointment, we can actually book an appointment from this call center for you, either after mobile crisis, after the phone call. When we know a crisis situation has occurred, we can get you right in to connect from that point forward. So those are really, really exciting aspects of this. And our goal is that most people, just at the touch of 3 digits, can have the help available to them that they need. Now, there's other areas that we have needed to build up in this crisis continuum of care, which we are doing as well. Last year, our Oklahoma legislature appropriated dollars to us to fill in many of the gaps that exist. And one of those is what we call psychiatric urgent cares. So similar to how you think of a medical urgent care, we have these for psychiatric conditions or mental health conditions where you can walk in or family members bring you in 24/7. You'll be able to meet with a counselor, a case manager, have medication prescribed if that's what is needed. Just as if you were going to a physical urgent care, you can have that at your fingertips for mental health disorders. And we've had about 10 of those. I think we've got to around 10 in the state, By the end of this upcoming fiscal year, we'll have close to 25. So we really want to be building this capacity around communities across the state, in particular in our rural communities, so that people have a place to go 24/7. So if you think about, you'll have a place to call and someone to talk to, you'll have a place to go, and you'll have services after that to keep you building up your resilience, building up your skills. If medication is needed, to have that ongoing, to really try to make a difference in people's lives. So we're very excited about this. We're also standing up additional crisis units in our state. Those are short-term treatment places where if what you really need is to be in a safe environment and have further evaluation and therapy, we can do that short-term and get you back to your job, to your family, to your kids as quickly as possible. So we're really building out this entire continuum. We're so excited about it. We really feel like this is an important element in our state to really help reduce suicide. Because one of the things that happens in our state, when we look at people who are engaged in our system or in mental health treatment, they are not as likely to die by suicide. Where we see suicide happening is where people, through either stigma or fear or just not knowing where to turn, are not engaged in any kind of treatment. And they have events that maybe are just overwhelming their ability to cope with, and they don't know where to turn. And we want to be as open and welcoming for that individual with just a 3-digit number to prevent anything further from happening at that point in time.
We're about to jump into our first break. What's the timetable for the implementation of this program?
Well, July 1st we will go live. Now I will tell you, even though this is a nationwide number, many states have not developed this continuum. They're really in their infancy. But in Oklahoma, I would say we're in the top 5 of readiness for a full, robust continuum, if not higher. We're really excited about the support that we've received, both federally and from the state, to put into place the items that we need to make this successful.
Let me jump to a break. We'll get back and talk to more. We're visiting with Carrie Slatton-Hodges. She's the Commissioner of the Department of Mental Health and Substance Abuse Services, and we'll be right back.
One of the best kept secrets about the post 9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They're there to help you find the right school for you, the school that will help you and your family make great steps into your future.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank number 2 in the nation. OU Law, generations of excellence, limitless possibilities.
Welcome back to the set of The Verdict. Our guest is Carrie Slatton-Hodges.
Carrie, we were talking off camera on the break about the importance of the July 1 date for Oklahoma. Mm-hmm. You have told us in the first segment about at least 2 of the aspects of the new developments, a place to call and a place to go. Both of those will kick in July 1 of this year for Oklahoma.
That's correct.
Was that by design or by accident, or how did it?
Well, really it is a result of federal legislation that is putting into place this 3-digit number. And they chose July 1st as the date that the FCC will put this into place. Now, as I had mentioned, not all states will have as robust a system on July 1st. The number will turn on, but they may not have the various aspects of that crisis system that we will have here in Oklahoma. But when we were learning about this opportunity with the federal legislation, we knew that that was an opportunity that we really needed to leverage, to not just have a call line, but to put an entire system in place that could serve Oklahomans who had high levels of need, who were in crisis in the best possible way. And I think July 1st was picked because that is a standard fiscal year for most states. Yeah. And so that's the day that they chose to turn this on and to implement it.
Well, this is a great time to do this show then.
Absolutely.
We
Very
stumbled
timely.
into that.
Let me give you an opportunity to talk about other things that the department is doing.
We are so busy. When we talk about a crisis system, that's fantastic, but we are always trying to go as far upstream as possible. And the furthest upstream that you can get is prevention. And we do a lot of prevention work around the state, and particularly in partnering with our school systems to make sure that our youth growing up are in the best shape to tackle what will come ahead in their life. So, for example, one of the things that we work with schools on is to implement classroom management styles, Botvin's life skills, for example, that help kids grow up to be really resilient. And also to educate school systems about mental health conditions and educate their students. We just had legislation passed that was very exciting this year that said that all school systems will be required to enter into a memorandum of understanding with their local providers in what to do when there is a crisis, what to do when someone speaks about suicide. Because one of the reasons we want that partnership to be strong is that schools have children during the day, but after school and summer, they do not have those children, but the community provider is still there. So we want those partnerships strengthened. And so that's just an example of something that has recently happened. Last year, school systems were asked to have all of their employees trained in suicide prevention, suicide identification, prevention, and what to do. So since that time, since last July 1st, we've trained close to 15,000 school personnel in how to identify suicidal thoughts and what to do in those situations. So we do a lot of work on the prevention side, and then the entire continuum after prevention before you get to crisis. Because if we can be warm and welcoming and help people, then when they need it, prior to being in a crisis, we can prevent these bad outcomes from happening. So we are always trying to get the word out that treatment works. People can and do recover from mental illness and addiction issues daily, all the time. They have very high success rates. We just have to overcome those barriers such as stigma or being afraid that people will perceive you in some sort of different way that would have a negative effect on your life. And in fact, I would add there was a survey done a few years ago about stigma, because in my mind, I think, gosh, everybody knows about these diseases. They know they're diseases of the brain, just like any other. This is not a weakness, it's not a fault. But there was a survey done a few years back, and the majority of people in America feel like if they sought treatment, it would have a negative effect on their job, it would have a negative effect on their family, a negative effect on their income. So there is still a tremendous amount of stigma and fear that prevents people from reaching out and getting the help that they need to live a full, productive life.
Let's talk about the type of times when a person should call 988. Obviously, if I myself am feeling like I want to cause myself harm, then that number would be appropriate for me to call and perhaps get some help.
Absolutely.
But what if there's other people in the family, or what if you see someone that you don't even know, but they're exhibiting some sort of mental health crisis? Where do you draw the line into what's an appropriate time to call? I don't want to call and tie up somebody on the phone if that's not really an appropriate opportunity to reach out. So what do you suggest in that area?
So our goal is that the only number really that you have to remember is 988. And they will sort it out on the back end. So say, for example, you have questions or thoughts of whether you should be concerned or not about a family member. That's a perfect number to dial. They will make sure that that the thing that you are describing about what level of risk is there, they will help you with that. They will give you resources for you as a family member for how you can receive support. So that's a great example of when that would be completely appropriate. Say you saw someone on the side of the road and you were concerned about them, it's still a great place to call, because as part of our RFP on the call center, we actually had the statewide 911 coordinator as part of this. And so we put a lot of time and effort into making sure that we have great communication back and forth. So if it falls to something that really maybe should come over here, we can easily make that happen. But likely we may send a mobile crisis team out to that individual to ascertain what is going on, to see if they need additional help. So that's completely appropriate. And if you just want information, they can help you with that as well.
Domestic violence is a serious issue in the state. Does some of this cross over into domestic violence, and when would it and when would it not?
It does. You know, as part of our system, we ensure that there is a person at all of our treatment locations that is trained in domestic violence, that they have a liaison that has a working relationship with local domestic violence advocacy location. And so it works hand in hand. Our staff are trained to understand that there's certain things you don't do and there's certain things you do, because we never want to put anyone at risk, and how to make warm handoffs to ensure that that person is going to get the assistance that they need.
With these two systems coming online on July 1, is this going to have an effect on your staff? Is it going to have to increase?
So yes, absolutely. The entire continuum of care as we've been building it has continued to need increased staffing. So some of that is how you prioritize the use of your resources, and then some of that is bringing on new staff. What I would say is these are partnerships, so we as an agency are not personally doing all of this work. We have great partnerships around the state with so many treatment providers that we couldn't do our work without these great partnerships. I can tell you just this morning, which I have monthly, I had a meeting with all our substance abuse directors across the state, and we talk about what's going on, and we talk about where we're going from here and how we can support you. So we work with our partners to implement these different types of initiatives. But yes, there will definitely be more staff added over this crisis continuum to ensure that we can get the job done.
And the funding for this, is it a federal pass-through, or is the state coming up with it out of your budget? How does that work?
There's a number of different ways that it is funded. We fortunately received great support from the federal government, in particular SAMHSA, who is our federal partner. They increased block grant services and made a set aside within those block grant services specifically for building crisis continuums of care. In addition to that, our state legislature has just been so fantastic on working around mental health and addiction issues. Last year, they funded $7.5 million to go into building urgent cares and crisis units, as well as $3 million for mobile crisis teams in our state. So they have been an integral partner in making sure that this continuum of care gets built.
Fantastic. July 1 is when it starts. The number is 988. She is Commissioner Carrie Slatton-Hodges, our Commissioner of Department of Mental Health and Substance Abuse. Thank you so much for coming on the show.
It's been an absolute pleasure. Thank you for having me.
We're going to bring you back after a few months and get an update on how it's going.
That's great. I look forward to it.
We'll be back with a final word.
It used to be okay in hospitals. It used to be okay in movie theaters. It was okay in classrooms, restaurants, and airplanes. But thanks to a greater understanding of the dangers, that's not okay anymore. So now that we know secondhand smoke causes lifelong health problems, why is it still okay to smoke with children in the car? Bottom line, it's not okay. Let's get serious about protecting kids. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
You have children come from a different lifestyle, different mindset. You have to open your arms and really do what you have to do to have that child become a part of your family. And if it's more patience, that's what you do. Kids gotta know they can trust you. And that's what we've tried to do with these kids.
You will always be mom and dad to me.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Our guest today was Carrie Slatton-Hodges. She's the Commissioner of Department of Mental Health and Substance Abuse Services. And she was telling us about a new phone number that people can call nationwide when they're having some sort of mental health or substance abuse or suicide prevention emergency. And it starts July 1.
Yeah, and it's a locally administered program for Oklahomans. So if you make a call, you'll be addressed by fellow Oklahomans to help solve whatever problems there may be. Mm-hmm. You won't be dealing with somebody in Massachusetts or California.
Mm-hmm. And a reminder how important it is, the people that are answering those calls, think of the training that they have to go through, the sleepless nights they might endure on the other side of this job. So I mean, if you know someone who's involved in mental health on any level, I think they deserve a pat on the back and let people know how grateful we are that people are willing to take on that extremely tough issue. But again, that number is July 1. Some websites, oklahoma.gov/ODMHSAS, which is how you can reach Commissioner Carrie Slatton-Hodges. And we have a website, theverdict.tv. Tell us about a guest you'd like to see on a future show. We'll see you next week.